Hey everyone, and thanks for joining me on the Behavioral Health Matters podcast, presented by Magellan Behavioral Health of Pennsylvania. I'm your host, John Lees, and I'm the member and family advocate at Magellan of Pennsylvania, here in the Lehigh Valley. The mission of our podcast is simple: to promote positive mental health, provide valuable information, and reduce stigma. On this episode, we're exploring how a powerful partnership in Bethlehem is transforming emergency response and mental health support. And to help us learn more about this program, we'll be joined by the incredible team behind Bethlehem's Community Connections program. Michelle Kott, Bethlehem Police Chief, Benay Berger, Director of Nursing and Community Connections at Bethlehem Health Bureau, and Carissa Cam, Community Engagement Worker and Data Analyst. Join us as our guests guide us through the journey of the Community Connections program. We'll hear about its beginnings, its remarkable growth, the success and challenges they've encountered, and the powerful, positive change they're bringing to the community. And be sure to stay tuned at the end of this episode to learn how you can provide us with your feedback about the podcast and make suggestions for future episodes. And now here's my conversation with the team from Bethlehem's Community Connections program. Chief Kott, Benay, and Carissa, welcome to the Behavioral Health Matters podcast. It's great to have you all here. For our listeners who may not know you all yet, could you share a little bit about your background and your current role in the city of Bethlehem?
Absolutely. I'm Chief Michelle Kott with the City of Bethlehem Police Department. I've been a police officer here in the City of Bethlehem for 21 years.
My name is Benay Berger, and I'm the Director of Nursing and the Community Connections program for the Bethlehem Health Bureau. Backgrounds, undergraduate in political science and education, and then another degree in nursing, and now working to finish up my master's in clinical social work. And I've been with the Bethlehem Health Bureau for a total of a little over 6 years.
I'm Carissa Cam. I'm with the Bethlehem Health Bureau. My work is in community engagement and data analysis for the Community Connections program. My role is a blend of street outreach, systems navigation, and data analysis. I respond directly to the calls alongside police and follow up afterwards, helping individuals, especially those who are unhoused or facing mental health and substance use challenges, to get them services. That might mean coordinating with community partners, helping someone through legal system, or simply making sure people aren't falling through the cracks. I also track the data to identify gaps and trends so we can improve how we respond. My background is in intelligence and systems, but I focus on building relationships with both the community and our partners to make sure that our approach is practical, responsive, and grounded in what people actually need.
Well, that's great. Well, welcome again to all of you. We really appreciate your taking some time to talk with us today for this episode about the Community Connections program. So let's get into the program a little bit. Benay, if you could you start by giving us a brief history about the Community Connections program?
Sure.
How did it begin and what sparked the need?
Yes. So I'll start from the beginning. Every 3 years, the Bethlehem Health Bureau conducts a community health needs assessment. This is we work with our partners. We have a lot of partnerships in the community. So with our partners, with local organizations, community members, we do this assessment to see what the community thinks are the most pressing needs, as well as the providers who are going to meet these needs. So in the 2019 Community Needs Health Assessment, mental health was identified as a top concern. Actually, it had been for a couple previous too. So if for just a few numbers at that time, 37.5% of residents reported experiencing at least one poor mental health day in the past month, and 11.7% had received mental health diagnoses. I think for us, one of the most significant recognition was among adolescents. The 42.1% reported feeling sad or depressed most days in the past year, and 17.4% had considered suicide, and 9.9% had attempted it. So we've all been hearing about mental health, and it was confirmed that this was a top concern both among our residents and our providers. So in response to this, our Health Bureau Director, Kristen Wenwick, recognized the need for a robust public health approach to this issue. So after researching national models and doing a lot of looking around, the concept for the Community Connections program, the one we're talking about here today, was developed. So she and Chief Kott worked together. Chief Kott got us our first grant, and we worked on a pilot, started with a single social worker assigned to one platoon in the Bethlehem Police Department. And we have just grown. Today, we have 5 full-time and 2 part-time social workers and community health specialists, and they provide coverage through co-response with police, one-on-one with police. We have an internal electronic referral system. We work very closely with our community partners, and the breadth of how we do this program has really, really blown up. So it started back then, and our main role in this process is to help connect individuals in the community with resources they need at the time when they need it. We found that police were all of a sudden tasked with responding to any mental health crisis. And they're good at that, and they are trained for that, but that is not really their job. They have to do police work, and I know Chief Kott will speak to that. So we just have developed this program so that when we go out with police, whatever police or legal or criminal element is going on there, they deal with, and then we can take over with assisting clients and community residents and connecting them to services, especially mental health services. And the other part of the program is that we work with community partners who provide these mental health services, because we do not provide mental health services, but we connect people to existing services in the community. So 2019 started, and we've grown and are continuing full speed ahead.
Wow, it's such a, the approach is one that it really interests me in that, it sounds like there was kind of like an initial triage. So you're looking at data and getting information related to the needs, that needs assessment, and then trying to develop the program specific to those needs. And now it's grown, validating, yes, that data and that information was accurate and there is a need. And, it sounds like a wonderful collaboration. So I'm interested to learn more. So you mentioned this when you were introducing yourself, Carissa. From your perspective, working in the community engagement and data side of the program, what needs are you seeing in Bethlehem? I know Benay talked about some of the initial assessment and then the ongoing program development, but from kind of, your boots on the ground, what are you seeing?
Well, one of the biggest needs in Bethlehem is a stronger coordination between systems. People are often faced with multiple challenges at once. So that could be mental health, substance abuse, housing instability, medical issues, and involvement in the legal system. So they're expected to navigate all of this on their own, and that's just not realistic. Community Connections doesn't provide direct service, as Benay had mentioned, but we can coordinate across all these systems. So that's government, judicial, medical, social services, and mental health to make sure the referrals land where they need to go, and that providers are communicating and that individuals don't get lost in the process. Like in some cases, we've had Community Connections and community partners have come together in really powerful ways. We had one situation where the county was involved to get someone into a diversionary program. So a diversionary program, no one knows what that is. It's a program an individual would go through instead of having to do jail time from specific charges. So in this specific example, this person had a drug charge. So we're trying to get them through the LETI program, which is the Law Enforcement Treatment Initiative. So in order to do this, we had New Bethany stepped in because this person frequently accessed their service at their drop-in center. Conference of Churches was included because they have a relationship with this individual through street outreach, and street meds also made sure that all the medical requirements were taken care of, such as documentation to be admitted into a certain facility. The public defender and district attorney both supported the diversion, and the arresting police officer also helped in agreeing to take this route. But then the entire department were also helpful in helping us locate this person, because this person didn't have a phone. So trying to get in contact on a regular basis when it comes to paperwork, getting them to the facility was very difficult. So it took an entire team to coordinate on a daily basis across all of us. But we were able to get this person into the facility. But even with this level of coordination, we're constantly up against long wait times, funding shortages, strict eligibility requirements, and someone trying to change their life can be disqualified from a program just because of a record from years ago. So even when we're doing all we can, the system itself still creates barriers, and that's where the real work is, pushing those systems to do better so people don't have to slip through the cracks.
What I heard, needs are identified, right? And then figuring out who do we need to pull in here to address these needs. And that's not just going to be one system or one part of the community, so to speak. You're going to have to really, escalate that within the system and the community to access those other folks to help them understand, here's the needs, here's how we think you can contribute to move things forward. Is that my understanding? Yeah.
Definitely.
Yeah.
Yes, and but certain things pop up that we might not have foreseen. It takes all of us to try to remove those barriers and keep the goal and objective moving.
And I imagine that, go ahead, Benay. Go ahead.
No, I'm sorry. I just wanted to add something that's very important that Carissa said. Through the process of developing this program, we have been able to identify real significant gaps in the system. Even when we can connect people to programs and they can access that. Carissa said this very well. There's a lack of communication among the programs that need to collectively support sometimes one individual. And in identifying these gaps and working with our community partners, natural development is to find ways to fill those gaps. So we've also learned that through this process, together collectively with our partners, we identify these gaps and sit together to figure out, all right, what can we do so this doesn't happen again? So this gap is filled. So it's been a natural part development of the program as we grow.
Yeah, I know working in systems, I know it can be challenging because some systems might have specific constraints or challenges that they have to adhere to. So in order to be able to have those conversations, I imagine you really need just people to be open and hear and figure out if there's certain barriers or obstacles, how can we work together? And if one of those things is there's a gap, there's something missing in the community or within the system, how do we all collectively kind of analyze what that is and maybe what we can do to fill that gap?
And now, a brief word from Magellan. If you are a loved one or a Magellan of Pennsylvania member and have any questions about services, please visit www.magellanofpa.com for more information. Again, that's www.magellanofpa.com. And now, back to the show.
So just kind of along those lines and the collaborative side of things, Chief Kott, I'm interested to hear, what role does the police department play in this partnership? We've heard a little bit about it, but I can imagine it's a pretty big lift.
It is, but it's a necessary lift. So the police department plays a key role in the partnership with the Bethlehem Health Bureau's Community Connections program by providing a coordinated response to individuals in crisis, particularly those experiencing mental health, substance use, or housing instability challenges. Specifically, we are able to assist with crisis response support. So officers respond alongside or coordinate with Community Connections staff during behavioral health crises, helping to de-escalate situations and ensure safety. Through referral and connection, officers identify individuals who may benefit from Community Connection services and refer them for follow-up care and support, bridging the gap between law enforcement and social services. Information sharing. While respecting privacy laws, officers share relevant non-clinical information with the Community Connections team to provide more comprehensive and effective care for our community members. Through reducing arrests for nonviolent issues. By connecting people in crisis with appropriate care rather than defaulting to arrest or hospitalization, officers help reduce unnecessary incarceration and emergency room use. And then finally, it really helps with community engagement. Officers work with Community Connections to build trust with vulnerable populations in our community, aiming to improve overall public health and safety outcomes.
Yeah, that's so interesting. So it's such a great, to me, it just seems like such a great way to operate within the community. You're getting folks connected with the right resource. So if legal involvement isn't necessary,
what would be to help this individual or this family or whoever the community member is, right? But then that win-win is within the community where you're part of a team helping to try to figure out what's the best course of action here.
Absolutely.
And that's that community engagement piece.
And I'd like to actually give an example or a couple of examples. Like there was a time where a certain individual actually had a barrier that stopped access to medical and social services, being able to reach this person. Chief Kott was able to remove those barriers and continue service for this man who is in a wheelchair.
Oh, wow.
So, and that's the type of collaboration and work that the officers have also been able to do with us.
Yeah. And so I imagine a lot of this is about communication, whether it's directly with the individuals who are experiencing a crisis or having some kind of issue within the community, and then the systems and all of the collaborative pieces, being able to have open lines of communication and dialogue to get to the nitty gritty, like, hey, here's the need and here's what would be most helpful from our view. And then again, where possible, bringing in the right system and resource to meet that need.
Communication is key. We can't operate in silos anymore. It's not working. So we need to change how we operate as law enforcement, as social service providers. So communication is absolutely key going forward.
And I want to add, I think this is a really important part of the program that also just naturally developed, and that is that the Bethlehem Police Department has a lot of great officers. Really, I'm background in health and mental health, but they are all going to be trained in a crisis intervention model. And what this program has also done is to allow the community to see that the Bethlehem police officers are a resource. Now, if you're committing a crime and they're going to come and they're going to do the law enforcement part of their job, but they're a resource. And we've had a lot of people recognize that because they interact with the folks, and either they can handle the problem themselves or they refer to us, and they see that collaboration and that the Bethlehem police are really there to serve the community, and they do. And I have to say, this is a really great program and we've been successful, but a lot of that is due to the police that help and do act as a resource and really do care about the folks they're trying to serve. And that has been, I guess I just never thought about it, but that has become a very prominent part of, I think, wow, this is also really beneficial in that our community members see this side of how police serve the community.
Yeah, and that's what I was saying before. I think the openness to doing things a little bit differently in this way leads to improved community engagement, and therefore, again, everyone's a part of the community. And so if we're helping one another and being open to what can I do to help this situation, then I think it improves the entire community. And it seems like that's what this is really all about, and kind of the goal of the program. So that's wonderful to see that it was not only developed based on we've got these needs, but then also, continuing to evolve and improve that community engagement, community perspective, and just the community overall. Now, along those lines, I know there can be challenges within systems and developing programs and operating programs. So I'm interested to hear, and this could be a roundtable response, but what are some of the biggest challenges out of the gate when you were developing the program, but then also now that it's operational and running the program?
Well, I think one of the biggest challenges has been how the program operates in a space that doesn't really exist anywhere else. So we're not clinical, we're not law enforcement. I mean, obviously from Bethlehem Health Bureau side, we're not law enforcement, and we're not case managers either. But we have to work with and in between all of those roles, so that it could be confusing around what we do and where we fit, especially when new partners come into the picture. Another major challenge is sustainability. A lot of our work we do is intensive, and it's coordinating across the multiple systems, responding to referrals, tracking down data, and following up to make sure things don't fall through. But We're working with limited staff, no dedicated funding stream, and no billable services. So that makes it hard to grow or even maintain the level of support we're offering right now. And on a practical level, we're often stepping into very complex and high-risk situations that don't follow a script. So every case is different. Sometimes it takes weeks of engagement or coordination with one individual to finally accept help. That kind of work takes time, trust, and consistency, none of which are easy to sustain when the system we work in is often understaffed, overburdened, or fractured or fragmented.
And that was kind of what I was expecting was, a lot of the systems, helping systems are under duress these days. So, and you touched on funding a little bit there. So I am interested to hear more, Benay, if you can. Where did the original funding, you mentioned a grant, so where did the original funding come from for Community Connections? And then if you can also talk a little bit, is there a continuous improvement activity that you undertake to get feedback from folks who have had interactions with the program and kind of take a look at that feedback or any outcomes that can help to drive towards continuous improvement?
Yes, that's a good bunch of questions. So as far as funding goes, we currently have several sources of funding, but initially our program was launched with a startup grant from the Department of Justice, secured by Chief Kott. Really worked very hard to get that grant, because none of this really would be what it is without this, 50-50 collaboration. It is Bethlehem Health Bureau and police. One does not exist with this program does not exist without both and our community partners. So this initial grant provided the seed funding we needed to get the program up and running and started. But, as many grants are, it was limited to 2 years. And that's not a lot of time if you think of the scope and the depth of the work that we do. So we have been constantly trying to identify other funding sources for long-term sustainability. So right now, the Community Connections program gets funding from a maternal child health grant, Mare Health, that is recognized how, because of the holistic approach we take to dealing with clients, that mental health, physical health, psychological health, all of those things really need to be supported to have a healthy individual and to, at their greatest health potential. So we also have various city grants. We are currently in the process of applying to 2 other grants. And the city has recognized the success of this program and the power in the work that we do. So they also are committed to keeping this program going. But as our needs in the community have grown, our program has also grown. And we have expanded, as I said, in both staff and scope, and we constantly need to find ways to sustain that. And then that's ongoing. As far as the feedback from our clients, I think that was the second part of your question, collecting data, where are we successful, where are we having challenges, what would work better? We do that in 2 ways. So we have, thank God, Carissa is also a data analyst. She does a lot of things. And one of them is working constantly on our, we have an electronic database, casebook, where we store all of our client data and get a lot of, that's where we get a lot of our numbers. We utilize with the police department, the Mark 43 is an electronic database for them. We can collect data from there. We always try to do a 30, 60, 90-day follow-up with clients that we have engaged with services to find out, did they engage? Were those services the right services? Are they staying engaged, which is sometimes a really big issue. We have to constantly go back to make sure people are staying engaged. And then we record all that information in our system so we can get some analysis out of that. So that is, we also are always working on honing our data collection, because this is Chris, I think, said it very well. This is a program that kind of fills in a lot of gaps. We help communication among our existing programs. We provide not really direct provision of services, but we go in and we'll use some criminal justice navigation for clients who need it. We just, kind of zig and zag where we see needs are not being met. So, funding, welcome all funding. We're constantly looking for funding. Chief and Kristen Wenwick, the director of the Health Bureau, and Chief Kott are amazing at identifying potential grants and working together to make them happen. And we are always working on our feedback from not just the clients that we connect to services, but our community partners. We get a great deal of feedback there. We work very closely with them. We don't do this alone. The police department and the health bureau don't do this alone. We work daily with all of the other community resources. I'm sure we'll mention it sometime. It's so numerous to make this sort of tight network of support for some of our most vulnerable in our communities. So we're always seeking funding, and we get constant feedback through surveys and discussions with our community partners and surveys and discussions with our clients.
There was actually a survey as well through Cedar Crest. They came in and did a survey with the officers so that we can get feedback on what is working and what's not working. And immediately, Chief and Kristen and Benay really ironed out, like, all right, what's not working? What can we do? And they immediately had action items, and we were going after it. And I feel like it was a closer relationship now because of it.
Yeah. And it sounds like that experience has, you can build on that, I suppose. Like, if there's multi-steps to make any change in a program, it can take time. Maybe things get derailed. But if there's like the decision makers and you can pull them together and get kind of a reaction to whatever the situation, or in that case, the survey responses were, and then make adjustments quickly with, decisive action, I would imagine that helps to benefit those not only delivering it, but those receiving the services.
Yeah. I think you're right.
So talking about those community partners and others involved, Chief Kott, can you talk a little bit about others in the community, groups and providers who maybe have joined or supported these efforts?
So the response that we've received from stakeholders and the community when we rolled out the program and since rolling out the program has been overwhelmingly positive. Stakeholders appreciate the proactive, compassionate approach to crisis response, while community members have expressed gratitude for seeing officers work alongside health professionals to connect individuals with the care and services they need, rather than defaulting to enforcement and arrest. This partnership has strengthened trust, reduced stigma, and improved outcomes for those experiencing mental health or substance use challenges.
And I can imagine that really helps not only validate, but really drive the work, knowing that others are involved, supportive, and a part of the process.
And now, a brief word from Magellan. Are you or your child a Magellan of Pennsylvania member? Have you or your child received behavioral health services? Do you care about the quality of the services that people receive? Well, Magellan has an opportunity for you to help improve the behavioral health system. You can serve on a complaint or grievance panel, allowing you to have a voice in the behavioral health system. If you are interested in learning more about this opportunity, please contact John Berger at 1-877-769-9784. Again, that's John Berger at 1-877-769-9784. And now, back to the show.
So let's shift gears a little bit now and look to the future. Benay, what are some of the near-term and longer-term goals for Community Connections? And then if you can touch on what might be needed to help get there in terms of working towards those goals and achieving those goals.
Sure. So one short-term, medium-term, and long-term goal is funding and sustainability. We are constantly working on that in terms of, currently planning and thinking about development in the long term. That, of course, that funding helps sort of guide our decision making. We can do some things we can't unless we have that funding secure. But in the near term, another key goal is particularly a topic right now is connecting as many of our unhoused residents to the resources, programs, and services they need to transition from an unstable living condition into a more sustainable, safe, and healthy and productive situation. That's ongoing. That is, we've been doing this for months. We continue to do this, and we'll be going into the future. So that, it's kind of hard to say. We don't have any goals that are short term that we wouldn't extend into the future, but that has been a big focus of ours, particularly Carissa's, in terms of outreach and engagement in the last few months. The issues around homelessness are multifaceted and complex, and identifying individual needs and challenges, finding the services to meet those needs and the resources. It's not an easy task. That's why no one in the country or the world has really found a completely successful model for that. But that is something that we are working on right now intensively. Will, of course, continue in the future. That is one of our big short-term goals right now. And, sometimes we can encourage individuals to accept and engage and participate in services or resources, but they have to agree, and they have to do it and remain engaged and support. And of course, we will support that engagement. But that takes a lot of change, and change takes time, a lot of time. So once people are connected to the services in the short term, one of our medium and longer term goals is to keep them connected, follow that progress, make sure they remain engaged, and recognize what other supports are out there for them. So because we do crisis co-response, that's always an immediate response and connection, usually to immediate services for people where they are when they need them. And then I think the medium-term goal of recognizing the gaps in the services in the community, recognizing the communication that needs to be facilitated among all of the service providers, that's a medium to long-term goal as well. Another medium to long-term goal is to expand our hours of operation. Unfortunately, mental health crisis, social need crisis does not only happen between 8 and 4:30 on Monday to Friday. So we have expanded into the later hours. We have a social worker who works later into the evening based on data that the police and Carissa have accumulated. We've noticed where we've been tracking where some of the highest need is for an actual social worker to be engaged with the police. We do have coverage on the weekends. We don't have it 24/7, and sometimes they do need that 24/7. I did a co-response night shift with the police, and it was a really great experience, and they were really happy to be able to have, the resource of us, to have a social worker there, to have that person that can come up with the services that may be needed. And although the services might not be open at, 2:30 in the morning, a good example of one is we found a woman. She'd been kicked out of a house, and together with the police and I got her temporary shelter for a couple of nights. So it's really nice. It would be really nice to be able to have the personnel to expand our support with the police, 24/7. Another short-term, ongoing goal, building and strengthening our relationships with the local service providers to ensure we can connect people to the right supports. And then, of course, again, identifying where there aren't supports and collaborating with our partners to find out how we could maybe create the supports. The hospital systems, the mental health, the Lehigh County, Northampton County, we work very closely with all of those agencies to help identify unmet needs. So those, I think, cover most of what they all kind of shift from immediate is always getting people connected to services, and then the medium and long term are sustainability and increased access and development of resources and services for our residents.
So it's, again, interesting. You're using what's happening in the here and now, those near-term interactions and assessments of what's happening within the program to help analyze what's needed, like you mentioned, expanding hours and so forth, and other areas. And then that helps to build out goals that are really sounds like ongoing. You could call them future-oriented goals, but it's the work, it seems like, is continuous. So, but it does also sound like, just to reflect, there's been an arc from when you started in the growth to where you are and how you operate as compared to when you started So so I think establishing those goals formally is a good thing, it seems, and has helped to continue to grow the program, and that would, I would imagine, improve the program. And again, it's about supporting the community, the most important component. So, and so if Carissa, if someone was interested in either getting involved or just learning more about the program specifically, where would they go for information or connection? Or is there any particular websites or social media or a place they can call to kind of find out more about not only the program itself, but just maybe how to get involved in supporting the program?
So, well, anyone who wants to get involved, I recommend reaching out directly to some of the community partners who are doing the hands-on work every day. So that's like Conference of Churches, since they do street outreach, and New Bethany, since they have the drop-in center in Bethlehem. Those are good starting points. They also welcome volunteers. They work closely with the individuals in need and are always looking for volunteers, donations, and community supports. We are working on launching a website that would include information about community connections and broader efforts around supporting the unhoused population in Bethlehem. That will include updates, resources, and ways to get involved. Once it's live, it'll serve as the central hub for anyone who wants to understand the work or plug in. But for now, if you want to reach us, please get in touch with us by calling the Health Bureau. Our phone number is 610-865-7083. And maybe somebody in Community Connections will be able to give more information.
That's great. I appreciate that. I know the listeners will as well. And it's exciting to hear there's a website that's going to be put together, and sounds like that would be a really helpful step too, not only at promoting the program, hey folks, this is the work we're out here doing, but also for you all to gather information as well.
And now, a brief word about Community Connections. If you're interested in learning more or volunteering, you can get involved directly with the program's community partners who work on the front lines every day. Programs like the Lehigh Conference of Churches, who focus on street outreach, providing essential services like hot meals and housing assistance to those in need. Or New Bethany, who operates a drop-in center in Bethlehem, offering a range of services from food and hygiene support to transitional housing. Or the Bethlehem Emergency Sheltering, who provides a network of care and hospitality for the homeless in our community. These and other partner organizations always welcome volunteers, donations, and other forms of support. And while their website is under construction, you can learn more about the Community Connections program and how to get involved by calling the Bethlehem Health Bureau at 610-865-7083. And now, back to the show.
One of the things we established as a pillar or part of our mission for this podcast, and one of the biggest reasons that we got into this, was to help reduce stigma related to mental health. And so, Chief Kott, I'm interested to hear from your perspective, based on your experiences working in law enforcement and this mental health collaboration and system collaboration, really, have you seen over the arc of your experiences any reduction in stigma related to mental health? And then if you can speak again from your experiences and perspective, are there any steps that we can take as a community to continue to move forward in this area?
So we have seen meaningful progress in reducing stigma, especially through partnerships like the one we have with the Community Connections team. When law enforcement is seen not just as enforcers, but as collaborators in care, it helps shift public perception. People start to see mental health challenges not as criminal justice issues, but as health issues that deserve compassion and support. And then to keep moving forward, we as a community need to continue normalizing conversations around mental health, invest in training for first responders and community members alike, and make sure support services are accessible and visible. Most importantly, we have to lead with empathy. Every person in crisis is a neighbor, a friend, or a loved one, and our collective response should reflect that.
Yeah, and I just think that's such an important message to get beyond our formal roles into that word we've been kind of continuing to say out loud here, which is community. And again, when we established this podcast, we had several goals, but one of the most important ones was that reduction of stigma by just having conversations and ourselves as an organization connecting with others in the community who are providing support and resources to folks experiencing mental health or substance use crisis or needs. And so our feeling was, if we can have these conversations, maybe others out there in the community be more inclined to have conversations with their family, with their friends, and so forth. And so each one of those conversations really can help to kind of build some momentum. So I'm glad to hear that from your perspective, you've seen kind of a reduction and more inclination towards having these conversations and doing this work by those in the community, but also too, that the work continues. And so by continuing it, hopefully that continues that reduction of stigma, which is such an important thing. So, and Carissa, I'm interested to get any feedback you would have from the direct work you're doing as well.
So I actually see the difference, the training that the police get from the crisis intervention training, that I think about over 40% of the officers have been trained, correct, Chief, right?
That is correct.
And within the community, we've gotten overwhelming feedback of how empathetic the officers are. We've even had compliments coming from people who were arrested by some of the officers, writing letters of commendation on how they felt like the officers treated them like human beings, with respect, and they hope that other police departments will aim to have that standard of law enforcement implemented within their own departments. So I just wanted to throw that one out there, because I think it helps break down that stigma where everyone in the community, including the police department, can break down those walls or the stigma. And I think it's from Chief. She's very progressive in making sure that the fabric of law enforcement changes with the fabric of society.
Yeah, I think that's a great message, and I'm glad to hear that as well. That I really do think it's folks in leadership positions are tone setters, and so by establishing a certain kind of expectation that people are human beings and we have a role, when we have to be in the law enforcement role, that's what we're going to do. But we're part of this collaborative effort as well because we're part of the community. So I just think that's my perspective. I think it's a great approach. I've done crisis work. I've worked directly with individuals. I do that now in this role that I'm in. And I think just having conversations, really doing some active listening can help to kind of knock down some of the, for me, stigma kind of comes from the unknown. And so when we don't know something, we might tend to kind of, stand back from it or, react in a way that may not be so positive or helpful. But it seems like in this environment, really it is about community and supporting one another. So I'm really lifted to hear that response. So now we get to that time in the episode where, and we'll go round table again on this one, but, and we've covered quite a bit of ground and talked about a lot of different components of the program and the work that you're all doing. But if there was one thing, so this is our one thing question. If there was one thing that you would hope that listeners take away from this conversation today, what would that be?
Well, I hope listeners have a better understanding that real change in crisis response doesn't just happen through one agency or one approach. It takes coordination across every system: law enforcement, public health, the courts, social services, and the community. Even when we're all working together, the system still isn't built to make it easy for people to get help. So if there's one takeaway, it's that we have to keep pushing for better. That means supporting the organizations on the ground, staying involved, and being willing to challenge the barriers that keep people stuck. And that type of change takes effort, and it's on all of us.
From my perspective, I hope listeners take away the understanding that public safety and public health are deeply connected. And when we approach challenges like mental health, substance use, and homelessness with collaboration and compassion, bringing together police, health professionals, and community partners, we create better outcomes for everyone. And safety isn't just about enforcement, it's about care, trust, and showing up for people when they need it the most.
So I have to say, absolutely yes. So I also have to second Carissa's comment that I hope people walk away with the understanding that real change in crisis response and coordination of services doesn't just happen through one agency or one organization or one approach. If we want to make substantive changes in crisis response, as well as in the availability and accessibility of the needed programs, adequate mental health programs, housing programs, recovery programs, health and social service programs, that takes coordination across all systems. Hospital systems, we work with so many great organizations, Northampton County Human Services, Lehigh County's Human Services, New Bethany, Conference of Churches, Hope Centers, so many, police, Bethlehem Health. We have to coordinate and take this approach together to make this system work. So, the navigation through the court system, that's a huge area that we've needed to make sure is addressed. I think as far as stigma goes, I think what Chief Kott said is true. If we, and Carissa said is true, if we approach crisis with a caring, compassionate, and open mind approach, you can't arrest yourself out of a mental health crisis. You can't arrest yourself out of a substance use crisis. That's not going to help. You can arrest them. You can put them in jail. There could be a criminal element in there, but sitting in jail is not going to address the problem. So recognizing that, deal with the criminal issue, but then the diversionary program of getting people who are having these mental health situations and unmet mental health needs and are having substance use disorder with unmet programs, getting them into these programs, which is what the officers are also very, very strongly support. And again, that does come from the top. And the reason the officers are so great is because that is the message that the chief not only sends, but embodies and makes sure that they have the tools through this crisis intervention training to have that compassionate approach and to allow us to go with them and support them in the field. So I think that if we realize crisis and mental health and substance use is an issue, but we support it with compassionate, logical, productive response and approach, it will help us all in the community. So I hope people walk away feeling hopeful about our approach, maybe curious about how this works. As Carissa said, please go volunteer. We have a lot of people asking, how can I volunteer? We have great organizations, New Bethany, Conference of Churches, go volunteer in an existing Bethlehem area shelter. There are a lot of opportunities for volunteer if you'd like to be a part of that. And I hope they walk away with the curiosity about innovative approaches that we're trying to take to help us all as a community live better, healthier, happier lives. Because at the end of the day, we all rise together.
Well, I really appreciate those messages. I think it really helps to drive home, where this program came from in terms of its being created and developed and where it is today. And I also want to thank all of you, Chief Kott, Benay, and Carissa, for sharing your time with us. The information about the Community Connections program, all of your insights about the impact that it's having and continuing to have and will have in the future. I appreciate the work you're doing as a resident and part of the community of Bethlehem. And I just want to thank you all again for joining us on this episode of the Behavioral Health Matters podcast.
Thank you again for having us and allowing us the opportunity to spread the awesomeness that is this program.
Absolutely.
Thank you for having us and your continued commitment to destigmatize any kind of mental health issues. We love to talk about the program and appreciate the time.
Thank you so much.
Thank you all again. Take care.
Stick around. We'll be right back to wrap things up. So what did we learn on this episode? Well, we learned that the Community Connections program is rethinking how police and public health respond to mental health crisis together. We also learned that partnerships between law enforcement and health professionals can save lives and reduce stigma. And finally, we learned that if you're interested in getting more information about Bethlehem's Community Connections program, you can contact the Bethlehem Health Bureau at 610-865-7083. We'd like to thank our guests for joining us on this episode: Bethlehem Police Chief Michelle Kott, Benay Berger and Carissa Cam from the City of Bethlehem's Health Bureau. We'd like to thank all of you for listening to this podcast and invite you back for our next episode. And remember, if you have any questions or feedback about the pod, or have suggestions for future episodes, you can send me an email directly at jglees@magellanhealth.com. And if you like this episode, be sure to hit the like button and subscribe to our channel for more Behavioral Health Matters content. Well, there's the music reminding us that our time is up for this episode. I'm your host, John Lees, and while it's time to say goodbye for now, please remember, behavioral health matters.